Ramukgopa there, answering a number of questions from the media in his update of the state of play as far as the country's energy action plan is concerned, and a number of interesting points that have come out. One of them that stood out for me is that the grid collapse is highly improbable because of load shedding. If there was no load shedding, it could collapse, and the fact that business is being very supportive of the energy action plan that he is currently leading. And they are also looking at bringing back on stream some capacity in various places that have not been active, like in the Nelson Mandela Bay. There's a generator there that can add some 100 megawatts onto the grid. That's just one of the examples. We will, of course, tell you a little bit more later on about what has come out of that briefing by Minister Khusentso Ramukgopa. You're watching today on eNCA, DSTV channel 403. Very good afternoon to you. I'm Dan Moyane. Coming up on the show today, the Health Minister, Dr. Joe Phaahla, will join me shortly for an update on the cholera outbreak, the preliminary report into the babies who were placed in boxes in the Mahikeng Provincial Hospital, and he'll also share some more insights about the new health ombud. I'll also be talking to Esteban Gidici on the recently released Transnational Alliance to Combat Illicit Trade report. How is South Africa managing to fight against growing illicit trade? And then author and journalist Justice Malala will be talking to us about his book, The Plot to Save South Africa. This is about the days following the killing, the assassination of Chris Hani. And then author Cecil Morden about the release of Reiger Park, Home to Many, A Taste, an inspiring portrayal of a South African community's journey from the early 1890s until the late 1990s. Reiger Park is east of Johannesburg in what we know today as Ekurhuleni. Now, let's begin here. There's a new sheriff in the health sector, and is none other than Professor Thulani Mahwena. He takes over from the country's first health ombuds, Professor Mahwena, whose tenure ended on Wednesday after 7 years. Announcing his appointment earlier today, the minister, Joe Phaahla, says Mahwena is one of the most outstanding South African medical scholars who has transcended the globe to show the quality of the country's academic prowess. Let's discuss this and other health matters with the minister now, who's joining us live via Zoom from Pretoria. Dr. Phaahla, good afternoon. Welcome to today, and thank you very much for your time. Your comments earlier today about the incoming ombud as being an outstanding South African medical scholar, I guess, will be well appreciated by the sector. What are you, as a health minister, expecting from him?
Well, I'm expecting from him to just, steer forward the work, which very wonderful work, which was started by our first health ombud, Professor Mahwena, in terms of being the eyes and ears of the public in as far as services, health services in our country is concerned. Because the Office of the Health Ombud, it's basically the eyes and ears of the public. That's where if people are unhappy about and the services which they receive and in the public services, but also in the private health services, they are encouraged to submit those unhappiness to the Office of the Ombud. As already shown over the 7 years of Professor Mahwena, those are followed up, and then findings are made, and there will be recommendation for various remedial action. So I'm expecting Professor Mahwena, now that the office is fairly well established. Professor Mahwena did even also make some recommendations in terms of increased capacity in the office. So I'm expecting that Professor Thulani Mahwena will take this forward and make sure that this office can continue even better to be the eyes and ears of the public in as far as health services are concerned.
Have you, as government, and implemented the previous recommendations, for example, around life Esidimeni tragedy, and which Professor Mahwena was also involved with? He chaired that, and also the Rahima Musa Hospital situation. Have you acted on those recommendations?
Definitely, as you would know, in as far as the remedial action on the life estimate tragedy. That process on various fronts is still, some of it is still continuing, but a significant part of the work has been already done in terms of example, in terms of making sure that the patients who have survived can be taken into more secure facilities. That was done, immediately after the report, supervised by the National Ministry with the cooperation of the Gauteng province. That was already done, and of course, processes which also through the process of Judge Moseneke, the compensation processes have also been happening. And now we do have the process which is also in the courts today. Now, as far as the Rahima Musa, the more recent one, there is a program of action which has been adopted by Gauteng with our supervision and support. Amongst others, one of the immediate ones was that the CEO, who was found not to be very suitable for that position as found by the health ombud, was removed. There is a new acting CEO, and the province is in the process of a more permanent replacement of the CEO. But the number of other remedial actions in as far as improvement of various aspects of the functionality of the Rahima Musa Hospital have already been drawn by the Gauteng province, and we will be monitoring the implementation of those. And let me just hasten to say, while those are some of the high profile, but there are a number of other findings which, you may remember Tembisa Hospital, even in that area, in that case, the CEO was removed and a new management. I know there were other issues subsequently unrelated to that, but action has been taken and to make sure that the remedial actions are implemented.
Okay, can Professor Mahwena, as the incoming ombud, be assured of non-interference politically?
Well, definitely. You can. I'm sure if you read or listened to Professor Mahwena, one of the statements which he says emphatically is that throughout his tenure, he has never had any interference from Minister Motsoaledi, who appointed him, after him, Minister Mkhize, and in the last just under 2 years that I've been the minister in this department, I've never interfered with his investigation. And okay, he would, once there's an investigation, he will just inform us that there's a complaint which I'm investigating. And when I'm done, I'll give you the report. So okay, he can attest.
You can attest, he said yes. It. I was just verifying with you that the incoming ombuds can also be assured of the same non-political interference.
Definitely. Okay. The precedence has already been set. There's not going to be any change.
Okay. So let's come to a current issue, the cholera outbreak. Is it over?
Not over. It's not over. But in terms of the kind of severity of the outbreak, it's definitely at a much lower level. There are still new cases. Even as of this morning, we still received the report from the NICD that there were new cases. In the last 24 hours, I'm just looking quickly at the report, there were 11 cases reported through laboratory confirmation. Of which 10 in Gauteng, still in the Tshwane area, and 1 report in the northwest. So there are still 11 cases new in the last 24 hours. But essentially, in terms of new confirmed cases, the numbers are sort of stabilizing downwards. Also, in terms of, we don't have reports of, serious ill patients. Of course, sometimes because cholera can change very quick, just like the case of the deceased in Mpumalanga at Mamitlake Hospital. By the time we got the report, the patient has already passed away. So it can be very quick. Sometimes it's not a disease which takes a long time to get severe, but at this stage, on that level as well of severity, we're not getting any indications of any of those patients being admitted in severe conditions.
Why is it taking so long for you in the health space and for the council on the ground to pinpoint the real source? You have mentioned that there was a gentleman who traveled from Limpopo to come and join a police academy in Hammanskraal, and he's the first person that was recorded to get sick. But still today, we actually don't know, where did this start?
It's the nature of the illness, Braden. If you remember, that's the difficulty sometimes with infectious disease. The only definite spike or spark of the cholera which was able to be pinpointed was the two ladies who had traveled to an endemic country of cholera, Malawi, in February, in fact, late January, and came back early in February back into Gauteng. And because that was contained in the household, they traveled, they came back, and they fell sick. And when they were tested, they were found to be positive for cholera. And it was in one household, and it was people who had been on the same trip into one country. So that could be pinpointed. But otherwise, in this case, because in terms of the spark of the spread in Tshwane, what needs to be followed up now, where the gentleman came from, which is Musina in Limpopo, was not known to be having other patients with cholera. Unlike Malawi, which is known to be endemic with cholera, Musina in Limpopo is not known to be endemic. So we need to then still verify as to if even though he was the first one in the Hammanskraal area to be sick and found on diagnosis of laboratory tests to be positive for cholera, whether that actually from there, I mean, there are a number of others in the college who also fell sick and tested positive. But into the community, just a day or two after, what then led to the community around. Of course, the college and Kanana township are not very far from each other. It's about 3 minutes by car and maybe 10 minutes walking. So in terms of how that could have clearly happened from the college, it's feasible that from the college then the spread into that community, as I say, is very close.
You say
people could have shared. Yes.
Yes, Minister. Sorry to come in there. In the interest of time, you say that it's very difficult because of the nature of the disease, but Hammanskraal has become the epicenter. Are you confident that the measures you've put in place currently on the ground, with the numbers declining, will lead in the near future to an end of the outbreak?
We need to continue to follow contacts in the community, in the households, and make sure that everybody, especially in the area, adheres to the health measures. So it's a very kind of, you need to be very sticky in following up all the pattern and the individuals and encouraging them to that basic hygiene. And if we do that, it's highly possible, especially if in terms of bulk service source, especially water, it's not actually, I mean, if it's also properly treated and it doesn't become a risk where from individual it can then get into bulk services, then in maybe in the next 2 weeks or so, we could see a much more steady decline reaching a level where the whole chain can be broken. So it is possible.
Yeah, so you'll declare the outbreak gone when there's no zero case over a period of time, or is it a 24-hour period? One day we wake up, there's no case, we say it's gone, or you have to watch for a few more days?
We'll have to watch for 2 weeks. We'll have to watch for 2 full weeks. That's the only time that we can say that it looks like the chain has been broken.
Okay. So zero
cases.
Zero cases would have to be sustained over a 2-week period before we can say it's over. Yeah. Okay. The other issue that has come up, while I have you, Minister, is what happened in Mahikeng Provincial Hospital with the cardboard boxes and the babies and the incubators. Our reporter Puleli Jones was in Mahikeng Hospital. You know, in fact, I think he was born there. My colleague Puleli Jones, and having seen that, I mean, I am sure it was a bit of an embarrassment. How did you feel when you saw that? And are you comfortable that, although you are at national level, that the provincial health structures in the Northwest are now dealing with this matter properly? Because it looks like it was twofold: lack of resources and bad management.
Well, I actually was informed by the MEC before I saw the pictures. He did communicate with me by message to say, please be aware that there is this kind of matter which has been brought to my attention. I'm following up to get the details, and then I'll give you a report. And subsequently, he then came back to say, I can confirm that this has happened. I'm following up to understand all the relevant people on the ground, those who were in the wards at the time of the delivery, and also the supervisors across the various value chain of the hierarchy of the hospital. And so I encouraged him to leave no stone unturned in terms of finding out what went wrong. Clearly, as I said before, we know that our hospitals are under stress in terms of adequate resources. As the report indicates, possibly there was pressure, which indicates, the high level of activity in terms of, the resources, the cribs and the incubators which were available at the time, as they indicate about, I can't remember, I think about 57, and then there were over 60-something babies born, which they couldn't have enough of those equipment. But as we have said, and I want to repeat that, with all the empathy for the pressure under which our frontline health workers do function, but we need to make sure that issues like that can be prevented, especially where you are able to can pre-plan, or even when you see that things are going to be under pressure, to be able, there must be a recourse in terms of who's the next manager to be able to approach and seek assistance. So the MEC will have to, my understanding is that he is following up on that. I know that from some quarters there's been unhappiness that it looks like the people who are taking responsibility are only the frontline nurses. But I'm sure in the further remedial steps, even those who are in supervision will have to account as to what support are they giving to the frontline workers when they encounter particular, difficulties. So these are the things which, while we encourage that there should be remedial action, but you must also learn to make sure that things like this are not repeated going forward.
Yeah, they shouldn't be happening at all. On another matter, there are doctors, I've seen reports saying there are doctors who have worked, their contracts have expired. For example, in the Pretoria Academic Hospital, I don't know if you are aware, they have not been paid. Why is that we always have a problem about paying the health practitioners when those who were employed, their contracts and some reason? Do you know why, Minister?
I'm not familiar with the immediate one you're talking about. I know there was a problem earlier, quite early in the year at Chris Hani Baragwanath Hospital, where at that stage it was interns who were newly employed, and the Gauteng department did have some explanation, which is still not acceptable, because in this day and era, we have digital systems where people's particulars are captured. And so that, look, in my era when I started working, which is a bit of a donkey years ago, when things were still very manual. I remember, one time when I was working in a hospital in KwaZulu-Natal, and I was not paid for 2 months. The only way one of my, friends who knew the problems of the system then encouraged me to travel That time I was in a hospital falling under what was KwaZulu government, and me and him had to drive to Ulundi so that to go and trace why I was not paid. So we don't expect those kind of things at this time and era with all the systems, the modern systems. So I'll have to, I'm not very familiar with the immediate one. I know the Gauteng, even though still the fact that a week or two after finishing the month, those interns had not been paid. They did rectify, and you know, as I'm saying, that
shouldn't be happening.
Is still not acceptable. I will need to get some more details just to check where it is.
It shouldn't be happening. Yeah, I know there's a different role you play at the national level than the provincial health MECs, but when we look at you, we look at the health department as one big integrated health organization, public health organization for the country. Let me take you back to where we started with the health ombuds. The outgoing, the former, let's call him the former now that you've appointed Professor Mahwena from now on. The former ombuds said that Gauteng and the Eastern Cape, in terms of the public health system, they are in a dismal state. And something has to be done. When you look at the landscape, not that there are no problems in other provinces like Mpumalanga, Limpopo, Free State, Western Cape, Eastern Cape. And Gauteng and Eastern Cape are bad. I mean, Gauteng is a hub of the country, but Western Cape is doing very well. When you look at this landscape of the health set up in South Africa, why is it that Western Cape would be doing better public health-wise than Gauteng, which is the engine room number one economically in the country, for example?
The situation in Gauteng is totally unacceptable, and it's not a rocket science. It doesn't take rocket science to trace why it's like that. Over many years, Gauteng has had serious instability of leadership, starting right at the top in terms of MECs, and then also at HODs. You can trace that for, I think, at least in the minimum over the last 10 years and more, that there's been, you know, very regular instability right at the top in terms of especially MECs and HODs. If you look at the sixth government, the sixth term of government, which is the 2019 to where we are, which is ending in 2024. Gauteng has had, I believe, at the current moment, the fifth MEC, some who have been interim, like Jacob Mamabolo, and then he was replaced, and then that MEC also left, and I think it's the fourth MEC currently. But also heads of department, there's been a head of department suspended, resigned, acting, new one, acting. In terms of HODs in this last 4.5 years, we're looking at 5 HODs, including those who acted for short periods, and even currently. Unfortunately, even when they thought they had found an HOD early last year, that HOD did not cope. There were just too many issues. And ultimately, in less than a year, she resigned. They went back to an acting HOD. So that's where I'm saying it's not rocket science. If you look at the Western Cape, they have had one MEC, I believe, from as backwards, possibly at least as within the term of the fifth, that is after the 2014 administration. We started 2014. And continued also in 2019. So you've got an MEC who by next year will finish 10 years.
So part of the problem, sorry, Minister, to come in there. So part of the problem you're saying is the lack of a stable leadership structure in the Gauteng Provincial Health Department. Do you have influence over that? Can you pick up the phone and say to Panyaza Lisufi, for example, don't change the MEC for health until the elections next year?
I can only appeal and advise. I have no authority to say this will be the case.
Okay.
I can only advise him.
Okay.
And that's how the political architecture of our country, even at HOD level, it's appointed by the Premier on the recommendation of the MEC. Even there, we do talk.
Yes.
Previous Premier and current Premier, we talk very regularly, He takes advice, he asks for advice, but at the end, the decision is going to be the Premier's decision.
Well, keep on talking and influence him in the right direction. Minister, the final question I have for you is about nurses. I understand that we have a law that preventing the training by private health care